Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. I'm here with my guest and friend, Brand Newland, the CEO and co-founder of Goldfinch Health. Brand, thanks for joining me today.
Logan, it's great to see you again.
We'll dive right in with, you brought some show and tell. So tell me about this lunchbox and why it says prepared for surgery.
Yeah, I thought this would be an interesting talking point for our brief discussion today. So we learned through our first 4 years of experience with supporting patients through surgery and recovery that there were some tangible pieces to the puzzle, some things that you would like to have in your home the week as you prepare for a hip replacement or a hysterectomy or whatever the surgery might be. And they're not just nice care package items, they're meaningful resources to you as you prepare for and recover from surgery. So we put this together. It's called the Prepare for Surgery Toolkit. It includes things like a supercharged Gatorade that you can have up to 2 hours before your surgery that helps people recover sooner and faster and better manage pain, believe it or not. We also include a pack of gum. That gets people's attention. The pack of gum, it's sugar-free gum, just regular gum. Helps get your GI moving. It helps with nausea and vomiting, which is common after surgery. Just helps you feel better.
Yeah.
We include an opioid disposal pack in the Prepare for Surgery Toolkit.
What's that all about?
So our goal in all of this is how can we improve pain management, reduce the number of opioids that are prescribed, further reduce the number of opioids that are needed or used by the patient, and then get the rest out of that person's house.
Got it.
The opioid crisis has many causes, but one of them is too many opioids left over, and those pills getting diverted. And that leads down a dark path.
When I had my wisdom teeth removed, I was given between 30 and 40 Vicodin.
Yeah.
I used one, and then I had a bottle of 29 sitting at home.
Yeah, and it's not as if you want to keep them around. A few people might say, well, I'm going to keep them around just in case, or maybe I'm going to have a migraine. I would say it's a bad idea. But most people don't do it for that reason. They just do it because it's complicated to figure out what to do with them, right? When's the take-back day at my police station? When's the take-back day at my pharmacy or whatever? With the disposal pack, you can safely put the leftover pills in a bottle, shake it up, throw it away. It's environmentally safe, gets them out of the house.
Okay, so the idea behind Goldfinch Health is you are helping people before and after surgery, giving them the tools they need to have a better surgery experience so that they're not getting on opioids afterwards.
Right, yeah.
Is that the baseline?
The opioid piece of it is a core part of our mission. When we launched the company about 5 years ago, that was part of our mission. We knew that wouldn't be economically meaningful enough for all the types of groups that we wanted to talk to. For example, one of our primary targets are employers. And not every employer automatically thinks that they have an opioid problem in their employee base. But they do care about how soon I'm getting someone back to their life, back to work. So we care about that also. Obviously, those two things are very closely intertwined. If you're having a better pain management, opioid minimizing surgical experience, well, that's the same formula for someone who's going to have a great experience with surgery, put it behind them, get on with their life.
Besides the kit, which is great, what are some of the other ways you can help people have a better surgery experience?
The biggest way,
besides gum and the supercharged Gatorade.
Well, the clinical basis for everything we do is called Enhanced Recovery After Surgery. That's been around for 20 years, 7,000 plus peer-reviewed journal articles. This works. It's the formula. Unfortunately, it's only done about 5 to 10% of the time in America.
Why? That's crazy.
It's one of these issues of misaligned incentives or just not fully aligned incentives. Surgeons and surgical providers are people too. They don't always read something in a peer-reviewed journal and immediately implement it.
Okay.
What we thought, and kind of the key insight for us in launching Goldfinch, was the missing piece to the puzzle was patient demand and understanding, as well as, and perhaps even more importantly, employer and payer understanding and demand. So that's what we set out to change, is create a program that made sense to the employer so that we could then turn around and go to the health systems and the providers and say, hey, the patient knows about it now and they like it, and the employer knows about it now and they like it.
What I hear you saying is that there's a known gold standard that's going to get you the optimal result.
Yeah.
And only 5 to 10% of people are getting it. They might be getting a standard of care, but they're not getting that gold standard. Maybe it's not even the gold standard. It's just a good standard.
Yeah, much better.
It's a much better standard. Gold suggested it's sort of out of reach.
Right.
You know, a better standard that has been agreed upon, that this will get you to recover faster. Fewer opioids will be required, but only 5 or 10% of people are getting that.
Yeah, and the crazy thing is it's not as if there's an enhanced recovery protocol and then there's some other type of protocol that we're competing against. What we're competing against is status quo, just sort of the old way of doing it, the way that I was trained in residency or fellowship, and it's just sort of evolved over the years. But there's not a science-based approach that competes against enhanced recovery. Enhanced recovery is the clear, optimized way to go through surgery and recovery today. It just needs to be done more frequently, and that's what we're out there trying to get done.
On the optimistic side, are you seeing a shift just in terms of the generational divide of physicians? Are younger doctors more inclined to do enhanced recovery?
That is true. That is true. Especially the opioid side of this, where there's a lot of awareness around the dangers of opioids today, thankfully, right? Yeah. What we've been through in this country and continue to go through. That has led into a significant amount of research on how can we mitigate opioid use and better treat pain. The answer to that is multimodal pain management, so taking advantage of other types of pain medications and even non-pharmacological options. There are folks here at this conference talking about things like virtual reality, right? And there's even some non-technological solutions like ice and heat and some of the old standbys that get underutilized. But if you put those all together, you've got that state-of-the-art pain management. You just need some guidance to get there.
Yeah. Let's talk about why now is a unique moment in time for addressing the opioid crisis.
Well, unfortunately, we find ourselves 20 years into the opioid crisis, and much has been said about how we got here and exactly why. What's resulted is a number of lawsuits. The major companies that are involved and have been involved in some way, shape, or form in the opioid crisis in America were part of these lawsuits, which have been settled for the most part over the last several years, to the tune of approaching $60 billion. $60 billion with a B. Those dollars will now go to states, counties, cities, tribes who are part of the opioid lawsuits, and they are being charged with this task of mitigating the opioid crisis in their area, utilizing those funds.
Wow.
And so some of these groups, at the state level, they're receiving hundreds of millions of dollars over the next 18 years to apply towards prevention, treatment, and recovery of the opioid crisis. And while I'm sad about how we got here, and I wish this wouldn't have existed in the first place, I have a lot of optimism about what we can achieve with $60 billion invested wisely in prevention, treatment, and recovery.
That word wisely is key because it would be easy for a city, county, town to receive money and not know how to spend it in a way that's effective. Are you concerned about that?
I am, but thankfully we've been able to be part of the solution. The state of Iowa has hired us to deploy some of their funds in a prevention program where we are going to rural communities and helping to train hospitals and providers on opioid mitigating care pathways, updated opioid prescribing practices, better pain management practices, and supporting their patients through a change period to show them, just as the data shows, patients not only won't do worse, they do much better when you have an opioid mitigating approach.
Interesting. So that's in Iowa. Do you see that as a model that you'd like to roll out in other states?
Yeah, so very quickly we saw with this evidence-based model an opportunity and an ability to reduce opioid refills after surgery to under 1%.
Wow.
So it's making a big difference. The state of Iowa recognized that and quickly increased the size of that program they'd hired us for from 10 hospitals and 500 patients to 35 hospitals and 2,000 patients. And so I see a model where we can repeat this, we can scale this. It makes sense as a prevention effort in all 50 states.
Yeah. Talk to me about how you're reaching consumers, people, doctors. Is this something that the consumer can come to directly? I know I have a surgery and I want to get the best surgery possible. Can I find out where to go?
You can. That is something that happens relatively uncommonly, to be honest with you, but that does happen. Most of the time, the way a consumer or a patient, if you will, is coming to us today is either their employer, their union, their spouse's employer in some way, shape, or form has the Goldfinch program, and a member of our nurse team calls you because you have a surgery coming up and we find out about it.
Gotcha.
Or you can call us. Or in this Billion Pill Pledge, that's the program in Iowa, the Billion Pill Pledge program, your hospital might be involved. And they're referring you to us and saying, you're going to hear, as part of our care, you're going to hear from somebody called Goldfinch Health. That's an extension of us.
Got it.
And they're going to be there to help support you and help you feel confident and prepared for surgery, just like the toolkit, as you get ready for that surgery and recover from it.
You've mentioned multiple tools in your toolkit. how big of a deal, it feels like it's a big deal, how big of a deal is that personal touch of just having somebody pick up the phone and say, I know you got a surgery coming up, what are your concerns, have you tried this? I mean, that seems like a big
It's huge. To be honest with you, when you asked me what are the key elements of an optimal surgery experience, I just about answered it's having a personal nurse that you can talk to. Because that human touch element, especially when that's an expert, especially when it's a nurse who's just got a lot of expertise in translating the complicated and making it simple, right? That's really what it's about, especially when you're feeling anxiety and stress around something like surgery. So that nurse piece, that personal touch, somebody checking in on you, not you trying to call off hours or work your way through a calling tree to talk to your provider about a question you have. No, this nurse called you just to check in. That makes a big difference.
You mentioned the billion pill pledge. Can you explain what that is?
Yeah, billion pill pledge. There are 3 billion leftover pills after surgery each year in the United States. Our goal, our mission, is to reduce that by 1 billion. That's the billion pill pledge.
Okay. And what do you feel like the human impact of that could be?
That would solve the opioid crisis, at least the future of the opioid crisis. You know, the last thing that we want to happen, there's a lot of work that's needed to resolve what's going on around the opioid crisis. We have record deaths of overdoses of fentanyl. There's so much going on. But the last thing we want to be doing is creating a new opioid-dependent user today. We know better today that we can do so much better for people. And I think the Billion Pill Pledge program, if we maximize that, scale that, repeat that across America, that is shutting off the spigot of new opioid-dependent users after surgery.
Got it. If someone's watching this and they're interested in collaborating with you, what's kind of the profile of an ideal partner for Goldfinch Health?
I'll answer this in 2 ways. On the employer side, on the group payer side, the types of groups that are finding a lot of benefit from our program today, labor unions, municipal groups, sheriff's departments.
Because you mentioned the thing about the economic side, days away.
Right.
Have you quantified that?
We did do a study this past year with the Validation Institute where we showed 32 days saved in recovery time, 32, just over a month, as compared to the standard of care or the benchmark.
A month?
A month faster return to work.
Okay, wow. Okay, so you said unions, large employers.
Manufacturing, construction, those groups really, not that it couldn't be any employer, but those groups really see a benefit. We just signed our first school district, a school coalition as a client. So that's one category. On the opioid settlement side, that's trickier because it's still being figured out in many states. Legislative process, legislators are going to be part of that in many states, and in certain cases, task forces or the Attorney General's office. So any connections in those areas, very helpful at this time.
Got it. You sort of outlined this, but I'm just curious, what are you most excited about for the next 12 months?
I'm really excited about showing the results from what we're doing in Iowa and helping those 35 hospitals and those 2,000 patients to mitigate the opioid crisis, as we talked about, in really shutting off the spigot and being a prevention solution there, because it's going to be a model. Every piece of data, every testimonial, every case study that comes from Iowa will be a bit of fuel to the fire for the rest of our country in deciding how to, again, wisely deploy those funds.
Brand, thank you for taking this time with me. I love what you're doing. This is something that needs to catch fire across the nation, and it's a point of prevention it's innovative and creative. It's going upstream versus another rehabilitation center, another, when we've waited too long.
Yep.
So I love the thinking, the business model, and wish you the best of luck this year.
Thanks, Logan.